Welcome back to Today's Health. Today we're talking about bariatric surgery options with board-certified general surgeon Dr. Zubin Bhesania. Doctor, in this segment, let's begin with what bariatric procedures are available at McLaren Port Huron.
At the hospital, we offer 3 surgical options. We have the gastric band, the gastric sleeve, and the gastric bypass.
Let's begin with the gastric band procedure. Can you tell us how this helps an individual to lose weight?
Sure. This is a minimally invasive procedure where we place a device, the gastric band, around the very top of the stomach. And what it does is it controls your appetite by restricting food in your stomach. So the device has a balloon on the inside of it, and the balloon is attached to a catheter that we access to add fluid. And so we can make the balloon tighter or looser depending on its fill volume. And by doing that, we can adjust the flow of food in the stomach and make you feel full sooner, and so you lose weight. The operation works purely by restriction.
Can you describe for us what happens during the procedure?
So the procedure is done laparoscopically. We have very small skin incisions, and we place these little plastic sleeves through the abdominal wall to pass our instruments through. We'll have a camera and we'll visualize the stomach, and we'll then do a small dissection around the stomach to place the device. The device gets placed into the abdominal cavity, and then it's placed around the stomach and then secured. We actually secure it with a couple of sutures to hold it in place. And as you can see, there's a catheter that comes off of the balloon portion of the band, and that's attached to a small port that lies underneath the skin. And it's a port that we access when we adjust the band. So this is just showing the port being applied to the abdominal wall. The port's underneath the skin. You can't see it, you can barely feel it. And once the balloon's in position, what we're trying to show you here is that we restrict the amount of food that enters into the stomach. To adjust the band, it's very simple. It's done in the office setting. We can add some saline to it to make it tighter. We can take saline out of it to make it looser. And that's the critical part of the band, is the follow-up. If the band's not properly adjusted, you won't have good weight loss. So it's real important for patients to understand that if they have a band, there's a significant amount of follow-up that occurs over the first 2 years.
How often does the band need to be adjusted?
Typically, it's about once a month. For the first 18 months, we have to watch the patient.
Now, what do individuals need to know about the benefits versus the risks of this procedure?
Well, all patients understand there's a risk-benefit ratio. All surgeries have some risk involved, but hopefully the risks are very diminished compared to the returns of losing weight and controlling the other comorbid problems associated with obesity.
Okay, let's move on next to the roux-en-y gastric bypass procedure. Can you tell us about this?
Sure. This is an operation where we actually divide the stomach and divide the small bowel and sort of change the pathway of food, okay? So this operation works by restriction and malabsorption. The restriction component occurs because we're dividing the stomach and making it much smaller, and the malabsorption, the bypass component, is created by bypassing 90% of your stomach and about half your small bowel.
This sounds like a much more involved procedure. Can you tell us what happens during the procedure?
So we have an animation for this as well. Once again, these procedures are all done laparoscopically, so they're very small incisions on the abdominal wall. We place these plastic sleeves through the abdominal wall. We'll have a camera that's placed in the abdominal cavity, and we'll see the anatomy up on a big TV screen. The stomach is found. We do a dissection of the stomach, and we'll actually cut the stomach with a special stapler. The stapler cuts and seals. And here we can see we've divided the stomach, creating a very small pouch. We'll then cut the small bowel and then bring the loop of small bowel up to the proximal stomach that's been divided, creating the bypass. So as you can see here, 90% of your stomach, about half your small bowel has been bypassed, so food does not come in contact with that, and that creates the malabsorption. So you can see the blue is the food pathway, and the yellow is the bile and stomach secretions that will join the small bowel further down to aid in digestion.
Now, what are the benefits versus risks for this procedure?
Well, this procedure is more invasive than the other bariatric procedures, and so where we divide the stomach, there's always a risk of leakage, bleeding, scarring, or perforation. So thankfully it's very, very low, but as a patient you need to understand that and understand the potential risk of the procedure.
So generally speaking, the more invasive the procedure, the risk increases a bit.
Correct. So the more complicated the procedure is, there's a higher risk of complications.
Doctor, this is great information. We need to take another break. We'll continue in a moment.